Good morning, everyone. Today I wear my nursing uniform, so I'm just gonna talk a little bit about blood pressure number. Some people might already know, some might not. So I just say it because from my experience, a lot of people don't understand what it is, where it's come from, and what does it mean. Blood pressure usually have two numbers. The top number is higher than the bottom, and it's very important to say it both number at the same time, right? So we kind of know what's going on. By textbook, the blood pressure they consider 120 over 80 is kind of normal, right? Now let's talk about the high number 120. In medical term, they call systolic pressure. Systolic is mean compressed, okay? Systolic pressure meaning is the number of the pressure of the blood that's go against the artery. Why we hear it, okay? It mean when the heart contract, they push out the artery into your body, and this blood, when it hit the artery, it create a sound. When we hear with the stethoscope or with a digital machine, the first sound that we heard is the sound of systolic pressure. It's usually louder, all right, and it show so many things. It show how is your heart doing and how is your artery doing, okay? So that's systolic pressure, the first number. And then the second number is called diastolic pressure, right? The meaning is it is the sound that we hear when the pressure of the blood in that artery when the heart is relaxed. I hope I didn't miss anything. So when the heart contract, they shoot out the blood in again. When they hit the artery, that's the first number, systolic number, the higher number. And when the heart relax, that pressure is dropped, okay? When that pressure drop in the artery, they create the sound. The sound change from the first one into the second one. That is the second number. It's called diastolic pressure, and it's usually less than 80. Okay, now let's understand blood pressure. If you have blood pressure 140 over 90, that is considered blood pressure, the beginning of high blood pressure. Okay, so you need to see somebody about that. But for the low blood pressure, the text says 120 over 80. But for some people, they were born and have the blood pressure that lower than that. Like for me, myself, my normal blood pressure is about 100 over 60. Okay, so it doesn't mean that I have to go see the doctor because my blood pressure is way low in the textbook standard. You have to know your normal blood pressure, and then you regulate your blood pressure and then go from there, okay? Like for me, if my blood pressure gonna go up to like 130/80, that is considered suspicious. Like why I have to investigate why my blood pressure go high. Am I stressed? Am I can't sleep? Or do I have high cholesterol? Because if you have a lot of plaque on your artery, when the systolic hit, when the blood hit against your artery, it can make it the number higher. Okay, so you have to investigate. So anyhow, if you have high blood pressure, you just need to be exercise, eat good thing, good food, and garlic is known to be food that help with the blood pressure. Fresh one, please, not dry powder one. I don't consider anything powder or dry have 100% of effectiveness in doing something. So you have to use the fresh one. And when you do the garlic, you use a fresh one, but please don't be too lazy. Get the one that is already minced, it's already chop it up, soak in the, I don't know, oil or water, and in the bottle. If you want a benefit of anything good, get it fresh and squeeze it, chop it up right there, right then, cook it, and then let it go. When you do that, you lose a little bit of benefit already from the heat. So if you go get the one in the pickle jar or whatever, who know what kind of, how many percent of benefit is still in there. Okay, so just eat everything fresh. Okay, so that is the story about blood pressure. I hope it's explained a little bit. This might just be the old story come to tell you guys. So if you already know, please accept my apology. If not, hopefully you can get some benefit out of my story today. And I see you later. Bye bye.